Understanding autism, a journey of early recognition. Bringing a new life into the world is an incredible experience. The joy, the excitement, and the overwhelming sense of responsibility are emotions that every new parent feels. It's a moment filled with dreams and hopes for the future. As parents, we cherish every moment of our child's development. Each day brings new surprises and milestones that fill our hearts with pride and happiness. We celebrate their first smile, their first steps, and their first words. These moments are precious and form the foundation of our memories. Sometimes, however, a child's development might follow a different path. It's not always easy to notice, but there are subtle signs that may indicate a unique developmental journey. They might reach milestones at a different pace. Some children may take longer to crawl, walk, or talk, and that's perfectly okay. This is where understanding Autism Spectrum Disorder, or ASD, becomes crucial. Autism is a complex condition, and early recognition can make a significant difference in a child's life. Recognizing the early signs of autism is not about raising alarm bells. It's about being observant and aware of the subtle differences in behavior and development. It's about equipping ourselves with the knowledge to support our children in the best way possible. Knowledge is power, and understanding autism can help us provide the right environment for our children to thrive. Autism is a neurodevelopmental disorder. It affects how a person communicates, interacts with others, and behaves. It affects communication, social interaction, and behavior. These challenges can vary widely from one child to another. It's a spectrum, meaning it presents differently in each child. No two children with autism are exactly alike, and their needs and strengths can be very diverse. Early identification paves the way for timely intervention and opens doors to a world of possibilities. The earlier we recognize the signs, the sooner we can start providing the support and resources our children need. This journey of understanding begins with knowing what to look for. Familiarizing ourselves with developmental milestones and being attentive to our child's progress is the first step. It's about recognizing subtle differences in development that might otherwise go unnoticed. These differences can be in how a child plays, communicates, or interacts with others. It's about trusting our parental instincts and seeking professional guidance when needed. If something feels off, it's important to consult with a healthcare provider. Remember, early detection is not a diagnosis. It's an opportunity to explore further and understand our child's unique needs. It's the first step towards understanding and supporting our children's unique needs. With love, patience, and the right support, every child can reach their full potential. Milestones and markers, a guide for the first 6 months. The journey of a baby's first half year is filled with incredible changes and developments that can be both exciting and overwhelming for new parents. The first 6 months of a baby's life are a time of rapid growth and development. From the moment they are born, babies begin to adapt to their new environment, learning and growing at an astonishing rate. During this stage, babies learn to focus their gaze, respond to sounds, and engage with their caregivers. These early interactions are crucial for their social and emotional development. While every baby is different, there are certain developmental milestones that typically emerge within this time frame. These milestones serve as a guide to help parents understand their baby's progress. Understanding these milestones can help parents identify any potential delays that might warrant further investigation. It's important to remember that each baby is unique and may reach these milestones at their own pace. One of the earliest milestones is eye contact. This simple yet profound act is one of the first ways babies begin to connect with the world around them. By 3 months, most babies will make eye contact with their caregivers. This is a sign that their vision is developing, and they are beginning to recognize familiar faces. They may also start to follow moving objects with their eyes. This ability to track movement is an important visual milestone that indicates healthy eye development. Another important milestone is responding to sounds. Babies are born with a natural ability to hear, and this sense continues to develop rapidly in the first few months. Babies should startle at loud noises and turn their heads towards familiar voices. This responsiveness to sound is a key indicator of auditory development. Social interaction also begins to develop during this stage. Babies start to recognize and respond to the people around them. laying the foundation for future social skills. Babies will often smile at their caregivers and engage in cooing or gurgling sounds. These early vocalizations are the precursors to speech and language development. They may also mimic facial expressions, such as sticking out their tongue or opening their mouth wide. This mimicry is a form of early communication and helps babies learn about social interactions. While these milestones provide a general framework, it's important to remember that not all babies develop at the same pace. Each child is unique and will grow and learn in their own time. Some babies might reach these milestones earlier, while others might take a little longer. This variation is completely normal and should not be a cause for concern unless there are significant delays. If you have any concerns about your baby's development, don't hesitate to consult with your pediatrician. They can provide guidance and support to ensure your baby is on the right track. From babbles to interactions, observing development from 6 to 12 months. This is a crucial period in your baby's life, filled with rapid growth and exciting changes. As babies enter their second half of the first year, they continue to reach exciting developmental milestones. These milestones are not just physical, but also encompass emotional, social, and cognitive growth. This period is marked by significant advancements in their communication, social, and motor skills. Babies start to show more interest in their surroundings and engage more actively with people and objects around them. Understanding these developmental shifts is key to recognizing any potential signs of autism. Regular checkups with your pediatrician can help monitor your baby's progress and address any concerns early on. Between 6 and 12 months, babies begin to babble more expressively. This babbling is an important precursor to speech and language development. They start stringing together consonant-vowel sounds like baba or mama. These sounds are often directed at caregivers, showing early attempts at communication. They also learn to respond to their own name and understand simple words like no or bye-bye. This indicates growing cognitive abilities and understanding of language. Their social interactions become more pronounced. Babies at this age enjoy engaging in simple games and activities that involve social interaction. They enjoy playing peekaboo, wave goodbye, and reach out to be picked up. These actions demonstrate their growing understanding of social cues and relationships. Motor skills also progress rapidly. Babies become more mobile and start exploring their environment with great curiosity. Most babies will start crawling, pulling themselves up to stand, and exploring their surroundings with increasing curiosity. This newfound mobility opens up a whole new world for them to discover. They develop better hand-eye coordination, allowing them to grasp objects with more precision. This skill is crucial for their ability to interact with and manipulate their environment. However, if your baby isn't reaching these milestones or you observe any signs of regression, it's crucial to consult your pediatrician. Early detection of developmental delays can make a significant difference. Remember that early intervention is most effective and can significantly support your child's development. Programs designed to address developmental delays can provide the necessary support and resources to help your baby thrive. Section 4. Toddlerhood and Exploration. Noticing differences between 12 and 18 months. Toddlerhood is a time of incredible exploration and discovery. Children become more mobile, their language skills blossom, and their personalities shine through. However, it's also a period where differences in development may become more apparent, including potential signs of autism. Between 12 and 18 months, most toddlers start walking independently. They develop a stronger vocabulary, using simple words to express their needs and wants. They also start engaging in pretend play, like talking on a toy phone or feeding a doll. Their social interactions become more complex. They begin to show empathy towards others, offering comfort when someone is upset. While these developmental milestones are important indicators, it's essential to remember that each child is unique. If your toddler seems slow in certain areas or shows unusual behaviors, don't hesitate to discuss your concerns with your pediatrician. They can assess your child's development and recommend resources if needed. Section 5. Growing Independence, Autism Signs. Between 18 and 24 months. Between 18 and 24 months, toddlers assert their independence more. They learn to follow simple instructions, engage in parallel play with peers, and express a wider range of emotions. However, this is also a crucial period where potential signs of autism might become more noticeable. One potential sign is a delay in language development. While some toddlers might be chattering away, others might be using fewer words than expected or not speaking at all. They might also struggle with social interaction, preferring solitary play or having difficulty engaging with other children. Some toddlers might exhibit repetitive behaviors, such as lining up toys or flapping their hands. They might also have sensory sensitivities, becoming overly distressed by loud noises or certain textures. If you observe any of these signs, it's important to remember that early intervention is key. Remember, early intervention empowers children with autism to reach their full potential. It's never too early to seek support and provide your child with the tools they need to thrive. Don't forget to subscribe for more insights and tips on child development and autism.